How can I treat fungal skin infection? Ringworm is a common infection disease. Ringworm is a common infection of the skin and nails that is caused by fungus. The infection is called ringworm because it can cause an itchy, red, circular rash. Ringworm is also called tinea or dermatitis. The different types of ringworm are usually named for the location of the infection on the body. Anyone can get ringworm. The fungi that cause this infection can live on skin, surfaces, and on household items such as clothing, towels, and bedding. Symptoms of ringworm infections. Ringworm can affect skin on almost any part of the body, as well as fingernails and toenails. The symptoms of ringworm often depend on which part of the body is infected, but they generally include itchy skin, ring-shaped rash, red, scaly, cracked skin, hair loss. Symptoms typically appear between 4 and 14 days after the skin comes in contact with the fungi that cause ringworm. Symptoms of ringworm by location on the body. Feet, tinea pedis or athlete's foot. The symptoms of ringworm on the feet include red, swollen, peeling, itchy skin between the toes, especially between the pinky toe and the one next to it. The sole and heel of the foot may also be affected in severe cases. The skin on the feet can blister. Scalp. Tinea capitis, ringworm on the scalp, usually looks like a scaly, itchy, red, circular bald spot. The bald spot can grow in size and multiple spots might develop if the infection spreads. Ringworm on the scalp is more common in children than it is in adults. Groin. Tinea cruris or jock itch, ringworm on the groin looks like scaly, itchy, red spots, usually on the inner sides of the skin folds of the thigh. Beard, tinea barbae. Symptoms of ringworm on the beard include scaly, itchy, red spots on the cheeks, chin, and upper neck. The spots might become crusted over or filled with pus, and the affected hair might fall out. How ringworm spreads. Number 1. From a person who has ringworm. People can get ringworm after contact with someone who has the infection. To avoid spreading the infection, people with ringworm shouldn't share clothing, towels, combs, or other personal items with other people. Number 2. From an animal that has ringworm. People can get ringworm by touching an animal that has ringworm. Many different kinds of animals can spread ringworm to people, including dogs and cats, especially kittens and puppies. Other animals, like cows, goats, pigs, and horses can also spread ringworm to people. Number 3. From the environment. The fungus that cause ringworm can live on surfaces, particularly in damp areas like locker rooms and public showers. For that reason, it's a good idea not to walk barefoot in these places. How is ringworm diagnosed? Your healthcare provider might suspect you have ringworm by looking at the affected skin and asking questions about your symptoms. Your healthcare provider will generally take a small skin scraping or nail sample to examine under a microscope or send to a laboratory for further testing. Treatment for ringworm. The treatment for ringworm depends on its location on the body and how serious the infection is. Some forms of ringworm can be treated with non-prescription over-the-counter medications, but other forms of ringworm need treatment with prescription antifungal medication. Ringworm on the skin or its foot, tinea pedis, and jock itch, tinea cruris, can usually be treated with non-prescription antifungal creams, lotions, or powders applied to the skin for 2 to 4 weeks. There are many non-prescription products available to treat ringworm, including clotrimazole, miconazole, terbinafine, ketoconazole. For non-prescription creams, lotions, or powders, follow the directions on the package label. Contact your healthcare provider if your infection doesn't go away or gets worse. Ringworm on the scalp, tinea capitis, usually needs to be treated with prescription antifungal medication taken by mouth for 1 to 3 months. Creams, lotions, All powders don't work for ringworm on the scalp. Prescription antifungal medications used to treat ringworm on the scalp include griseofulvin, itraconazole, fluconazole. Your infection gets worse or doesn't go away after using non-prescription medications. You or your child has ringworm on the scalp. Ringworm on the scalp needs to be treated with prescription antifungal medication. Use tea tree oil. Tea tree oil is naturally antifungal and antibacterial. Mix it with any carrier oil like coconut oil or olive oil and dab over the infected area about 3 to 4 times a day. Ketoconazole will kill the fungus and prevent it from growing back. Alternatively, common shampoos, like Head and Shoulders, contain selenium sulfide, another antifungal agent. Do a bit of shopping and find an over-the-counter shampoo that works for you. Make a paste with turmeric and water and apply it to the affected area. Lemon juice. Lemon juice's acidity may help inhibit fungal growth. Apply fresh lemon juice to the affected skin.